Welcome to our channel. Today, we are going to talk about an extremely important topic that can transform many people's lives: treatment for urinary incontinence with Botox. You may have already heard of Botox in the context of aesthetic treatments, but it has a fascinating medical application that many are unaware of. Urinary incontinence is a condition that affects millions of people around the world, both men and women, and can have a significant impact on quality of life, affecting confidence and daily well-being. Our goal today is to introduce you to an innovative and effective solution that has helped many patients regain control over their lives. The use of Botox to treat urinary incontinence represents a significant advance in the field of urology. Let's explore how this treatment works, why it's effective, and who can benefit from it. We will also demystify the process, explaining in a simple and accessible way how Botox injection into the bladder is performed, its benefits, and what you can expect in terms of results. Did you know that urinary incontinence does not have to be a permanent or unresolvable condition? Many people suffer in silence, believing that there are no effective alternatives, or that available treatments are complicated and invasive. However, Botox offers a relatively simple, minimally invasive approach to controlling overactive bladder symptoms while providing lasting relief. Today, we want you to walk away from this video with a clear understanding of how Botox can be a viable solution for urinary incontinence and how it can improve your quality of life. We will explain everything in detail, from the basic aspects of how Botox acts on the bladder muscles to the clinical results that prove its effectiveness. This is a treatment that has revolutionized the lives of many people, bringing back confidence and freedom to live without fear of accidents. If you or someone you know suffers from urinary incontinence, this video is for you. Get ready to discover new hope and a practical way to regain control of your life. Don't forget to subscribe to our channel to continue receiving valuable information about health and well-being. To begin with, let's better understand what urinary incontinence is. This condition is more common than many realize and can affect people of all ages, although it is more prevalent among the elderly. Basically, urinary incontinence refers to the involuntary loss of urine, which means a person cannot control when and where it occurs. This can range from small leaks when coughing or laughing to a complete inability to hold urine. Imagine how uncomfortable and embarrassing it can be for someone to deal with this on a daily basis, having to constantly worry about possible accidents. Urinary incontinence can be caused by a variety of factors, including weakness of the pelvic muscles, damage to the nerves that control the bladder, and even certain medications. Understanding these causes is crucial to finding the right treatment, and that's exactly what we're going to explore today. Now that we have a basic understanding of what urinary incontinence is, let's talk about how it can affect people's lives. The truth is that this condition goes far beyond simple physical discomfort. It can have a significant impact on quality of life, affecting self-esteem, confidence, and even personal and professional relationships. Imagine not being able to leave the house without worrying about possible accidents, or avoiding activities that used to bring joy and fun for fear of embarrassment. This can lead to feelings of isolation, depression, and even limitations in daily activities. Therefore, finding an effective solution for urinary incontinence is not just a matter of physical comfort, but also of emotional and social well-being. Fortunately, there are treatment options available, and it's one of them we're going to talk about today: the use of Botox to control the symptoms of urinary incontinence. Now, you might be wondering, Botox, isn't that what you use to remove wrinkles? Yes, you're right. Botox is best known for its cosmetic uses, but it also has important medical applications. Botox can be used to treat urinary incontinence, especially in cases of overactive bladder. Overactive bladder is when the bladder contracts uncontrollably, causing a frequent urge to urinate, and this is where Botox comes into play. How does the treatment work? Botox injection into the bladder. The procedure is performed using cystoscopy, an examination that allows the doctor to view the inside of the bladder. During this procedure, small amounts of Botox are injected directly into the bladder wall. Effect of Botox. Botox relaxes the bladder muscles, reducing involuntary contractions. This helps increase bladder capacity and reduce the urgency and frequency of bathroom visits. Effectiveness. Many clinical studies show that injecting Botox into the bladder is effective in more than 70% of cases. This means that most patients see a significant improvement in their urinary incontinence symptoms. Additionally, Botox treatment can be a great option for patients with multiple sclerosis, who often suffer from urinary incontinence due to overactivity of the detrusor, the bladder muscle. And that's it. Treatment for urinary incontinence with Botox is an effective and safe solution for many people who suffer from this problem. If you or someone you know suffers from urinary incontinence, talk to a specialist doctor to learn more about this treatment option. Leave your like, share this video with your friends. And don't forget to subscribe to our channel to receive valuable content about men's health and urology. Thanks for watching, and see you next time.